Hey everyone, every once in a while we come across a specific nutrient or micronutrient that has a lot of value when it comes to treating infertility. And in particular, one of the underlying factors that we need to treat in the majority of fertility cases is something called egg quality. And I know a lot of you are familiar with this topic. A lot of patients already come in with this topic in mind. Egg quality has a huge determining, is a huge determining factor on whether that egg matures, whether it fertilizes, and if it fertilizes, what the quality of the embryo is. And in general, higher quality embryos may have a better chance of success, better chances of implantation, and better chances leading to a healthy pregnancy. And when you go for a procedure like in vitro fertilization, the main, I think, hope when you go into that treatment cycle is to get as many eggs as possible, but not just any eggs. We want healthy eggs because the more healthy eggs we get retrieved from this in vitro fertilization, the more potential high quality embryos we have that we can transfer or we can freeze for a future cycle. So I usually tell patients, the focus of an IVF isn't necessarily the fresh transfer, it's a number of high quality eggs we retrieve, a number of high quality embryos we develop, because we can do a frozen embryo transfer easily in the future, potentially, for a lot of these couples. So, what are the things that can be done before an IVF to help improve your chances of higher quality embryos? So, a lot of patients, I think, are taken aback or are surprised when they first hear that they can actually do something to improve their chances of having higher quality embryos. And so I love this part. I love working on this with patients because it's very empowering. Instead of feeling like you're have no influence whatsoever on the potential outcomes of such an important and valuable treatment like IVF and such an expensive treatment, it is so crucial to take the few steps, these basic, easy steps and treatments to potentially significantly improve our chances of having a more positive outcome. And a while back, like I remember years ago where I was talking about CoQ10 with patients, it was still fairly new for a lot of fertility clinics. And how there was some early research showing how CoQ10 seems to be incredibly safe, seems to really improve egg quality, and may really improve pregnancy rates with IVF or fertility treatments. And now it seems like most fertility clinics are implementing this. A lot of new patients I see are already taking CoQ10 at the advice of their fertility doctor. And so CoQ10 is just the tip of that iceberg. There are so many important micronutrients that help in a very similar way as CoQ10 does to help reduce the damage to the eggs. And the main type of damage that can happen is something called oxidative stress. It's a type of stress or toxin almost that will decrease the integrity of those follicles. It can decrease the DNA quality or integrity of the follicles as well. And so there has been slowly more research about another micronutrient, and this one is called, as you might already be familiar with it, called melatonin. So melatonin is a supplement that's usually marketed to help patients with sleep. It's a hormone that helps to regulate our sleep and wake cycle. It's what causes jet lag. Usually, our melatonin and circadian rhythm are off. So taking melatonin can help us to adapt to a new circadian rhythm or adjust our circadian rhythm during travel, as it's been shown to reduce symptoms of jet lag or the duration of jet lag. But melatonin is actually has a kind of a double function. It actually moonlights as a very powerful antioxidant, and it concentrates in the follicular fluid of the ovary. So it directly concentrates in the follicular fluid of the ovary and it's a very powerful antioxidant. And I think it was estimated to be, can't remember how many times more powerful than vitamin C as an antioxidant, but very strong. So it decreases directly the oxidative stress that will impact the egg quality and the follicles in the ovary. So by reducing oxidative stress and increasing our total antioxidant capacity, we effectively can reduce the potential damage that this oxidative stress or the reactive oxygen species have on the egg quality. And another wonderful study was published recently this year. And what they found was that if the patient preparing for an IVF took melatonin, the couples that took melatonin had a significant increase in the number of follicles retrieved, the number of follicles that matured into healthy follicles, the number of those follicles that actually fertilized and led to an increase in the number of high quality embryos compared to patients that didn't take melatonin. And this is similar to previous findings that we've seen in smaller trials as well. Now, it's important to mention that any micronutrient, CoQ10, melatonin, any other supplement, have potential interactions with medication. So they're not safe for everyone. So you really need to talk and work with a naturopathic doctor to see if it's safe for you, because it can cause more harm than good if it's not suitable for you. But for a lot of cases, it's very has a very high safety profile, may have a huge impact on the potential outcomes of IVF. And micronutrients aren't meant to be used like one or the other. Micronutrients and antioxidants have a network, and they tend to work better together. They have a synergistic effect, so they support each other. So it's not just CoQ10 or just melatonin. Usually we're doing a combination of antioxidants and micronutrients that support overall total antioxidant capacity and function in the body to reduce this oxidative stress for sperm health and for egg health. But regardless, I just wanted to touch on this topic with you because I want you to feel empowered when it comes to preparing for an in vitro fertilization or IVF, and you can have a direct impact on its potential outcome. So it's not like we have to sit back and just kind of go for the ride and see what happens. There's a certain level of flexibility and potentially influencing those outcomes, and we can take those proactive steps and changes and healthy and lifestyle and dietary changes to help improve our potential outcomes. So if you're working towards, going through an IVF or an IUI, it's very important to look at all of these factors, micronutrients, fertility acupuncture, etc., as well as the dietary and lifestyle changes we often talk about on our blog posts and our research videos to help prepare for these IVF treatments. And usually we recommend implementing a lot of these treatments for at least 3 months before an IVF, because that's what they do in the research. It's about a 3 month time period before the IVF that we take to help improve and bring up the quality of those follicles. So if you have any questions, as always, drop a comment, send us a direct message, or shoot us an email. Take care, everyone.